An infectious and fatal illness that damages the brain and nervous system has been spreading among deer in the United States. As per December update from National Wildlife Health Center, a government organization dedicated to wildlife disease detection, control and prevention, chronic wasting disease is expanding and has been found in deer, elk and moose in at least 32 states and 4 Canadian provinces. As per this report, over the past 2 months, several areas of the country reported cases of the disease for the first time, including state of Kentucky, Yellowstone National Park and Coleman Country, Texas. Zombie deer disease is the nickname given to this illness because if it eats away the brain, and symptoms include excessive drooling, stumbling, head lowering, listlessness, blank stares and lack of fear of people, according to the experts at the Texas Park and Wildlife Department. As the name of the disease, that is chronic wasting disease or CWD, implies, animals also gradually become skinnier, emaciated or wasted over the course of 1 year or more than that. There is no vaccine or treatment and the disease is always fatal to the animals. This disease caused by abnormal protein called prions that accumulate in the brain and create a sponge-like holes in the tissue. The Wyoming Wildlife Federation designates it as a turning the brain into Swiss cheese. As an expert in wildlife disease ecology at Cornell University of Veterinary Medicine, if an animal has holes in its brain, it's not able to function normally, which includes finding food, and over the course of months it just wastes away. Experts add that this is really a sad way for a deer to die, and calling it zombie deer disease misrepresents the illness. A lot of people have ideas about what zombies are. The deer are not coming for your brains. Unfortunately, this is a disease that affects their brain, but they don't necessarily become aggressive towards humans. They are still living creatures and deserve a level of respect and empathy around what they are facing. Now the question is chronic wasting disease a threat to humans? Chronic wasting disease is transmitted by direct animal-to-animal contact or indirectly through contact with infectious particles that remain in the environment in the form of feces, soil or vegetation. Till now, there has been no reported cases of chronic wasting disease infection in people. The Centers for Disease Control and Prevention warns that a risk to humans may exist. The health agency cites some research suggesting that monkeys may become infected if they eat meat from CWD infected animals or come in contact with brain or body fluids of the infected animal. A research paper published in 2022 in journal Acta Neuropathologica found that the barrier for CWD prions to infect humans is not absolute and that there is an actual risk that it can transmit to humans. Experts say that there is a potential for chronic wasting disease to be zoonotic, meaning transmissible from animals to humans, just like COVID-19. Mad cow disease, which belongs to the same family of illness as CWD, originated in cattle, but humans can get a variant called Creutzfeldt-Jakob disease, which is fatal. To be on the safe side, health officials recommend that people do not consume meat from CWD infected animals. The World Health Organization has also stressed the importance of keeping the agents of all known prion disease from entering the human food system.